one of the most important things to work on is the climate crisis, because it's the only shot we have at making sure that us and the next generations also have a shot at enjoying life as we have growing up.
Climate change calls on us to evolve and embrace the unknown with curiosity. Today, we'll hear from someone who started out in the front lines of healthcare. When she realized the impact of climate change on health, she decided to bring awareness to this issue by becoming an educator. Embracing this path has led her to tackle climate change from a global health perspective.
Welcome to the Pulse of Change podcast, where we explore the connection between climate change and health by sharing stories about taking action. I'm Lana Voracek.
And I am David Acuna.
Our guest today is Raluca Radu. She's a registered nurse, an adjunct professor at the University of British Columbia, and a climate and health educator at Doctors Without Borders, also known as Médecins Sans Frontières or MSF.
In the first part of this episode, we'll hear Raluca's story about her journey from graduate student to educator. Next, we'll sit down for an interview about her work with MSF and the challenges that are faced by such a large global organization. Finally, Raluca will share what she's learned along the way and what keeps her feeling hopeful.
I learned that climate change had health effects. I remember getting so curious and looking for more opportunities to learn about these topics, because I felt that I, as a nurse, should know about how people's health is affected.
Raluca's story began when she took a step back from her 3-year medical surgical nursing career to pursue her graduate degree in nursing at UBC. At first, her introduction to climate change didn't come through her nursing education.
It was through the BBC Earth documentaries that I was religiously watching, and I was learning about various animal species and how certain species were becoming extinct. And, these terms around weather and extreme events, whether it was natural disasters or actually extreme weather disasters related to climate change, was terminology that started to kind of introduce me to the concept.
As a graduate student, Raluca started attending some webinars and seminars where she first heard about the impact of climate change on health.
I recall joining one of those sessions, and I learned that climate change had health effects. And that was something that beforehand I wasn't really able to wrap my head around, because, like I said, when I was watching the Earth documentaries, I thought those kind of effects were specific to animal species, to actual ecosystems. I learned in these webinars about how, for instance, climate can affect the air you breathe. And essentially, if you're exposed to bad air quality, you can have long-term health effects.
She didn't understand why she was hearing this information for the first time.
I started asking these questions that I had as a student at the time, as well, where is this content in the curricula in schools? Something I couldn't quite recall from my bachelor's of science and nursing training. I remember getting so curious and looking for more opportunities to network and to go to events and to learn about these topics, because I felt that I, as a nurse, should know about how people's health is affected.
Looking back on the work she had done as a nurse, Raluca realized the healthcare sector was having a major environmental impact.
In my nursing practice, when I was working in the hospitals in the Lower Mainland in Vancouver, one thing that stood out for me, but I wasn't making the link at the time to climate change, was the amount of plastic and waste, and the way that we weren't really sorting through different types of equipment or different types of tools we are using, especially working as a surgical nurse. You do dressing changes, you're putting IVs in, changing IV bags. So I remember at the time that, depending on the units I was on, I would ask, is there any policy around like how we're sorting things that are not necessarily contaminated by blood, or things that may pose a hazard if we were putting them in the wrong bins? And I recall that the answer was always no, just everything kind of goes in the same place.
She realized that, in turn, the waste produced by the healthcare sector could be worsening climate change and negatively impacting people's health.
I wanted to send the message to the next generation of nurses who were coming in. And so I started volunteering to essentially present, whether it was my colleagues' classes or it was in other universities as a student, the things that I was learning about.
In 2019, Raluca attended an event where she met someone who made the issue even more real for her.
She was a young female who I recall she was in her early 30s, so kind of a similar age I am at today. And she was in a wheelchair, and that was because of chronic pain and other symptoms she was exhibiting. But the way that she talked about how her quality of life changed from being a very active person, very involved, doing a lot of fun activities, and then having all of that change because of Lyme disease.
Lyme disease can be transmitted to humans from animals by ticks. Because of climate change, the habitat of the ticks that carry Lyme disease is expanding into Canada, leading to an epidemic. Lyme disease is among many other climate-sensitive infectious diseases whose spread will increase due to climate change. Without early treatment, it can lead to serious long-term neurological effects and disability.
That condition for her, although it's disempowered her physically, it actually empowered her to become a patient advocate for other people who may be in a similar condition, and to also use her personal story to educate physicians, nurses on her condition so that it can be earlier recognized among potential individuals we consider to be at risk. I remember her telling everybody in the room, I don't want you to feel sorry for me. What I want you to do is use this information and make a change in your practice. And so I think that we as health professionals have a duty to carry those voices forward. I think that we have a moral responsibility to make sure that we lift those stories in a way that is accurate and in a way that is truth-telling of the reality of what the patient is going through on a regular basis.
Later that year, Raluca was able to delve even deeper into the concept of climate change and health when she became a teaching assistant for the course Nursing 290, Health Impacts of Climate Change, at the University of British Columbia School of Nursing. At the time, the class was online and asynchronous.
I recall being very immersed in the conversations that students were having online and sharing their perspectives and stories on climate change. And interestingly enough, I graduated, and then in the summer of 2020, I was hired as lecturer. And one of the courses that I was assigned to was the same course that I was a teaching assistant in.
Her new role came with a new challenge. She was told she had to redesign the course to be live and engaging. It was difficult at first, but it got better over time.
By the time I was in my second year of teaching, I felt quite confident in that the structure of the course I created was more engaging and more open to inviting students to feel safe to become vulnerable enough to share how they felt about climate change, how it affected their lives.
Many students shared that the course had resonated with them, and for some, it even changed their career choices.
I had one student say, I was supposed to go down this path, but I decided to actually pursue an environmental-based graduate degree because I felt compelled from what I learned in your course. I think at the time, I was about a year and a half into my role, and I didn't think that somebody as young as me could have such influence. And I had a teaching assistant in the course who came in from a mental health background in nursing, specifically like no experience with climate change. And then by the end of her master's degree, she wanted to do her master's project on using mental health, her background there, in a way that engaged youth and voices of youth from the course into a mental health toolkit on how to overcome impacts of climate change from that perspective. I thought that was very powerful because, again, it was somebody who came in with a whole other approach to what they hoped to get out of their education, and then they pivoted towards somewhere where they felt they could have more impact. So those were some of the standout moments for me as an educator.
But she wanted to know how these issues applied outside of academia. So in late 2022, she began working as a climate change educator with Doctors Without Borders, also known as Médecins Sans Frontières, or MSF.
The transition has not been easy, but it's been very eye-opening in that you're learning about the raw, real elements that are interplay in the field for our staff. What I hear from the field is very different than what you read in textbooks. So it's been a very interesting professional journey, to say the least.
Coming up next, we'll interview Raluca about her experience working at MSF and some of the challenges she faces.
It's quite an interesting contrast between like my lived reality here in Vancouver versus that of somebody who's across oceans where you have conflict and other factors affecting your ability to work as a health provider.
Okay, so first of all, for those who might not be aware, MSF is a humanitarian organization that provides emergency medical care to people in need all over the world. So, to begin, what's it like to work at MSF?
We're definitely in every single corner of the world. And as an NGO, it's got a lot of different structures, as you can imagine, and governance levels that need to take into account the different responsibilities. And I think we have around 60,000 staff, and they're normally present in the most underserved communities in areas where there's significant conflict that takes place. Oftentimes, MSF tends to be one of few organizations that responds in those areas. And then on top of that, you're adding this ambitious goal of lowering its environmental footprint by 50% by 2030. And so they're using 2019 as a baseline to target how they're going to decarbonize. And that's where I come in. So I'm on the mitigation team.
What are some of the challenges you've encountered in this transition?
The question is always, how do we decrease our carbon footprint, but we still keep the high quality patient care? In textbooks, you say, well, you'll go from point A to B and you just follow this process. But then you have in the real kind of situation, the real world, you're at step 2, and then suddenly you have to jump maybe 2 steps back, or you have to jump 3 steps forward because there's constant variables coming at play that impact your ability to make progress, or sometimes that push you to fast track. So the aspect that I think still to this day is a challenge for me is, how do we reach the field? The staff who are actually at the front lines, seeing and witnessing patients coming in with rising cases of malaria, for example, in certain parts of Africa, or patients who are at the forefront of being displaced, like in Libya, for instance, because of the recent floods. I could come into a room full of people, like doing a webinar on here's the introduction to climate and health. And then somebody in that room who's been at the front line shares a story from the field. And now I just want to throw this webinar out because now I just want to learn about the community, the patient story, the full field raw reality, and how I can tailor my education to meet that reality. And so it's probably one of the most challenging roles I've had, because doing it remotely from a computer almost seems a bit surreal in that you don't really feel fully connected to the reality.
Can you talk more about that experience of giving a webinar and wanting to throw it out because of something that someone said?
I remember this very clearly. I was giving a webinar to a working group of healthcare providers who have been to the field. They kind of go back and forth between the offices at the operational centers, and then they get deployed in different parts of the world where MSF needs them. And I remember I asked them a question, and then one answer came back exactly with a question for me. And this was very early on in my role. I think I was 3 months in, so I was still very new. And I asked the question like, how do you see yourself as a physician, as a healthcare provider, in a way that you're practicing more responsibly with respect to the environment and with respect to the patients? And one of the participants in that webinar actually turned around and said, I'm not going to answer this question because I want to turn around and ask you, like, how would you expect me as a healthcare provider to work and be more aware of the environment when I have a patient in my operating room or in a community clinic who has experienced a traumatic event, whether it was related to conflict or whether it was related to being displaced from their home as a result of a climate event? Like, how can I worry about the environment when I'm worried about that patient's state? So I think it was just one of those scenarios where I guess I wasn't expecting, an audience member to respond, not with an answer, but actually to respond back with a question. Because not having the field reality, not having been there to actually see things for how having no proper infrastructure in place, having no access to medications that are essential and life-saving, having the possibility to be left without a home because essentially it's been washed away by a flood, I think is very difficult to wrap your head around in the context that I'm currently living in, where all I can be speaking to is, well, I was once affected by a heat dome in 2021, or I'm affected by wildfire smoke every year, where I feel it's just not the same magnitude or impact, right?
Right. And how did you respond when they asked you that question?
the reality is that I froze and I acknowledged that. First of all, I said, I'm really sorry that, I'm not able to really understand how difficult it must be because I haven't been in that situation. And I think that empathy is really critical in climate work. Like, I think empathizing with what people are going through and really doing a lot of active listening is so critical to self growth. But it was also about just trying for me to get to know that group and see how maybe if there's other ways through which I can provide that support. I think the overall takeaway has been in that people want to see, for instance, me going out in the field and actually seeing the reality and then taking that experience and using it to shape the work that I do. So yeah, it's quite an interesting contrast between my lived reality here in Vancouver versus that of somebody who's, across oceans, like in Bangladesh or Pakistan or in South Sudan, where you also have conflict and other factors affecting your ability to work as a health provider.
Yeah, absolutely. And recognizing that whether or not you are sent to the field is not within your control, how do you do the best job you can?
I'm trying to be very sensitive. I think I'm also being very diligent in terms of how to provide the information in a way that doesn't diminish or minimize the experiences that these people are going through. And then I provide support for people who want to be ambassadors. Some of the staff from MSF are very keen and are already involved with taking climate change action, whether it's adaptation through different education of local staff or whether it is mitigation by installing solar panels, for instance, in their hospitals, moving away from diesel generators. And it's just so humbling to see when people who are the least contributors to the climate crisis are the ones who actually want to do so much. And they really just want the information on how do I get started and how will you help me. And so I really think that we are going to see some pretty significant stories of inspiration.
I think in your story, you touch on a lot of really interesting things that we could dig deeply into if we had the time. But just to summarize some of the things that you said, you mentioned how in these countries, there's less resources, there's conflict, there's climate events. So there's an intersection where all these factors are happening in contrast to where we are here in a high income country like Canada. There's definitely an equity issue there in terms of like what is really just. And it's really interesting as well, thinking about the scope of a healthcare provider like a physician. Historically, the scope has been about that one patient. And in the context of the care of that patient, patient safety is the only thing that matters. But when we think about planetary healthcare, we have to think about the broader scope as well. And the question becomes, whose responsibility is it in which countries amidst these unfair distribution of factors to implement those things and consider the planetary health perspective? And how do we balance those things? And that's a lot of really difficult questions that we don't have the answer to. But thank you for the work that you're doing. Thank you for sharing. That's really interesting. Can you give some examples of the mitigation strategies that you're working on at MSF?
Right now, for instance, I'm working on how to change behavior around reducing the overuse of gloves in clinical settings. And so it was preparing a survey first to go out to staff, and then that later got translated by the leading nurse on the ground who was able to relay the results. It may sound small scale, but the idea is that if these projects work, we are hoping to extrapolate them and kind of spread them across the movement because we think it can have a significant impact from an environmental perspective.
Stay tuned for the last part of our episode, where Raluca reflects on her journey so far and shares some key lessons she's learned.
Once you start engaging in action, you're more than likely to overcome that eco-anxiety that's caused by climate change.
So the planetary health space is growing so fast, and you've been in it for a few years now. What are some of the biggest achievements you've seen throughout your time in this field?
First of all, I am just amazed and so inspired to see the amount of healthcare professionals worldwide who are starting to hop on this journey of embedding sustainability in their practice or focusing their studies on sustainability or on planetary health, because planetary health has been an emerging discipline and it's still emerging, I think, but it's much more well known now than it was when I started. The other aspect is also seeing the community of nurses in Canada growing who are actually partaking in this work. So, for instance, the Canadian Association of Nurses for the Environment has definitely grown its membership since I was on the board. And here in British Columbia as well, we have a working group that is tackling various provincial issues. It gives me hope because I know that people who are health professionals are very, very well positioned to start being in policy decision making spaces and to have that ability to provide influence because they're trusted by the public. There's a lot more trust in that type of role than in a generic politician per se. The fact that I know physically, I know people who are doctors, nurses who are tackling these issues as we're speaking right now, and they're advocating and they're pressing politicians and they're participating at COP and they're going, even if maybe they're not necessarily supposed to be part of those conversations and they're speaking to media. I think it's really moving for me as a nurse because, again, it just kind of reinforces that one of the most important things to work on is the climate crisis because it's the only shot we have at making sure that us and the next generations also have a shot at enjoying life as we have growing up.
One really interesting thing you mentioned that I want to highlight was the idea of doctors and nurses going to climate forums like COP, even if they aren't supposed to be part of those conversations. I think that's a really interesting thing to say because it's like maybe we need to push the boundaries of who is supposed to be part of those conversations and question whether those people are really able to speak about the health impacts of climate change and how those impacts are a concern for everyone's well-being. What else do you think we need to focus on as we move forward with this issue?
I do still think that we have yet a long ways to go, I think, in where we need to be today. And I don't want to just speak to Canada alone because I know that Canada is way behind its targets, compared to other parts. But I also think it's like thinking about what do we have access to that could provide support to those who are facing the most difficult effects of climate change. How can we help, especially we, I mean, those who have the power, the resources, the knowledge? How can we provide that support to communities who are more underserved and don't have the infrastructure, don't have the funds? How can we make sure we distribute resources such that they're equitably distributed and that they're accessible for people who experience vulnerabilities? As a side note, I mentioned inequities in low and middle income countries, but we know for a fact that there's serious inequities here in our own backyard from communities like in the downtown east side who are experiencing marginalization and experiencing homelessness, who are predisposed to significant health effects.
Absolutely. That's important to highlight too, because as you mentioned earlier, people who experience vulnerabilities likely won't be represented at these decision-making tables. What makes you feel inspired and hopeful as you continue to engage in this work?
If I know that I've gotten like one person to start changing one small behavior or to start engaging with these topics by, hey, I really like what you said in this talk and I've joined another talk because you piqued my interest. I think that to me keeps me inspired because I know that continuing to talk about these issues works, and it works well when we do it such that it leaves people with a positive note. And I think the other aspect is actually once you start engaging in action, you're more than likely to overcome that eco anxiety that's caused by climate change. The other aspect is, I think, when we see, for instance, healthcare systems. So, for instance, the NHS in England, their mode to operate has shifted towards being fully sustainable as a healthcare system with really strong targets to reach in the next 5 to 10 years. And they are actually serving as a significant role model for many other healthcare systems around the world. And so that to me is inspirational because it's showing to me that healthcare systems can also adapt and change to meet with the times we're in right now. And I know that's happening locally as well. For instance, with the new St. Paul's hospital that's being built, they've taken into account emissions. And there's also positions across the lower mainland that are climate change health leads recently hired over the last year or two. So these opportunities for people who have a lot of experience and passion to come in where they're not only working with government, but they're working with communities. And they really are pushing more for models of community-based approaches and partnerships because they know that those are the ones that work the best.
That's great to hear. Thanks for sharing that. We're nearing the end of our time together for today, but we're wondering if you can share with our listeners what are some of the key lessons that you've learned on your journey?
In this space, I think you're constantly reading the latest news and updates and the latest forecasts in how things are going to change. And so it can often be very distressing, of course. So I've learned how important self care is. And all of us have gone through so much with the pandemic. And I think we're still trying to heal the wounds we've all accrued, whether they're physical or psychological. And I think that probably many of us have experienced burnout in one way or another. So I think that's very prevalent as well in this climate change space. What self-care looks like for me may be different for you, but I can't emphasize this enough. It's just finding that outlet, whatever that is, that extracts you from the space you're in to get that energy back. And I think another thing has been to welcome the unknown with curiosity, because as you've learned earlier in our discussion, I came into a role that was completely different than what I had training for. And so oftentimes it means that you have to get super uncomfortable learning things that you may feel like, how do I belong here? It's very technical, or I'm a nurse. Like, how does this relate? But then really finding ways to connect the dots through maybe activities you've done in the past. So it's just getting comfortable with being uncomfortable.
I think those are great points, especially since, as you mentioned, the space is evolving as new information emerges, which means we all need to get comfortable with being uncomfortable. What would you say to our listeners who might be feeling worried about climate change or might want to engage in climate work? Do you have a call to action that you would share?
Every and any level of activity or action that is addressing the climate crisis is better than not doing anything at all. If you start engaging in any level of activities that first bring you joy and that you can share with those you love or those whose company you enjoy, you will feel more drawn to keep doing it because it feels good. And then in that process, you will see that you're not fearing what you've learned about climate change and what you're learning about it, because you know you're doing something about it in your own ways. Try it once and try it with someone, because there's more power in community when tackling this difficult crisis that we're in. If I look back at my childhood, growing up in Romania, I've had the privilege to have like all the different seasons and to experience winter at its fullest as a kid, playing in the snow, to like having normal summers in the sense like temperatures that weren't making you feel like you will pass out because of the heat, to having beautiful spring. So I think the more we go towards reducing or eliminating fossil fuel dependency as much as possible, the more we give nature a chance to actually replenish again, as we've seen in the early stages of the pandemic when the world shut down and then we were seeing like wildlife come into spaces where they weren't present before. You could hear the birds chirping. I really keep going back to this concept that as humans, we are guests on this planet. We should be taking care of our only home. There's no planet B. We have to safeguard it if we want a chance to see it thrive.
We first interviewed Raluca in September 2023. Since then, she's had an opportunity to apply her experiences in academia and global health and bring them back to her local BC context. In April of 2024, she joined Providence Healthcare as their first ever planetary health lead, a newly created position to support the organization's transition towards more sustainable and resilient care amidst the climate crisis. Looking back on her journey, she has one last piece of advice to share with you.
I would highly recommend to anyone to be a bit disruptive, to take a leap of faith and to not be afraid to change their context, because when you change your context, you also open yourself up to new ways of doing things. Any opportunity you have to learn from someone who's outside your context, I think, is an opportunity that should never be passed upon.
Pulse of Change is hosted and produced by Lana Voracek. Audio production and music by David Acuna. Artwork by Alana Thorburn-Watt. If you enjoyed this episode, follow us wherever you get your podcasts and leave us a review. You can also find a transcript with citations for this episode in our show notes. This episode was recorded and produced in the traditional unceded ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations. This podcast is funded by the Sustainability Projects Fund of the Alma Mater Society at the University of British Columbia, Vancouver. If you'd like to connect with us on social media, you can follow our Instagram at Pulse of Change Podcast. Thanks for listening.